It goes without saying, but the liver is one of the most essential organs in the human body because it filters and removes toxins that are produced on a daily basis. Fatty liver disease is a condition that occurs whenever too much fat builds up around the liver and unfortunately can have detrimental effects on the rest of your body. Poor lifestyle choices can contribute to a fatty liver, including heavy alcohol consumption and an unhealthy diet. With that said, in order to avoid this condition, you must first be aware of the most common signs and symptoms that it causes. And that is exactly what we are going to discuss in this video. Be sure to watch until the end because there's one that not too many people are aware of. So, if you're ready, let's get into it. Just a quick reminder, we are not doctors. This video is for informational purposes only. The first symptom that I want to mention is abdominal pain. Pain in the abdominal region, specifically a dull, constant pain that doesn't go away, can be an indication that an underlying condition, like fatty liver disease, is present. In most cases, the pain is located on the upper right side of the abdominal area, where the liver is located. Generally, the abdominal pain will coincide with digestion problems and indigestion. While abdominal pain isn't a clear indication of fatty liver disease on its own, it is often present with the other symptoms that we'll soon talk about in this video. Next up is fatigue. People suffering from fatty liver disease are often fatigued even after they receive a good night's sleep. Excessive daytime sleepiness is the most common symptom of this condition, and nearly all individuals afflicted report suffering some levels of fatigue. In fact, some patients complain that the fatigue is so overbearing that it negatively impacts the quality of their life. Experimental findings have associated fatigue due to fatty liver with changes in the way the brain facilitates neurotransmission. It results in both physical and mental fatigue, as the central nervous system is affected at the core. In many cases, individuals with extreme mental fatigue are unable to gather the motivation to perform basic tasks and require assistance from others to meet their basic needs. Another common symptom of fatty liver is a loss of appetite. This is commonly associated with fatty liver disease because the hormones that control hunger are negatively affected. Without adequate quantities of hormones to stimulate hunger, your appetite will vanish, which could indicate that there is a severe problem. Additionally, fatty liver disease contributes to abnormal glucose regulation and lipid metabolism. Without consuming sufficient calories and being unable to pull from lipid stores for energy, the body quickly deteriorates when the liver doesn't function properly. And that leads to the next symptom on our list, which is unexplained weight loss. Weight loss attributed to fatty liver disease is often a direct result of a lack of appetite, as people will be consuming far fewer calories if they aren't hungry. However, there is more to it than that. While the connection between fatty liver disease and unexplained weight loss is unclear, research points to extreme oxidative stress that results from abnormal fat metabolism. In other words, this means that the liver becomes compromised and is unable to break down fat for fuel. Nausea is another symptom to be aware of. In most fatty liver disease cases, other symptoms will appear before nausea. Therefore, if nausea is present, it indicates that fatty liver disease has progressed to an advanced stage. People who suffer from fatty liver also often suffer from gastroesophageal reflux. This results in stomach acid flowing out of the stomach and entering the esophagus, which leads to both nausea and vomiting. Another reason why fatty liver disease causes nausea is that the liver is unable to filter out toxins and waste products from the bloodstream. As these toxins build up to elevated levels, they can be responsible for making you sick to your stomach. The next symptom that we need to discuss is weakness. Weakness is a common symptom of advanced fatty liver disease because the neuromuscular dysfunction associated with changes in metabolism is a common consequence of a malfunctioning liver. If the liver doesn't do its job properly, the central nervous system is unable to function like it normally would, and this results in feelings of weakness. In other words, both weakness and fatigue are the results of the central nervous system that can't perform properly because the body is under a chronic toxic load. as the liver is unable to filter out toxins. The liver has a primary role in energy metabolism, as it regulates fat metabolism throughout the body. If the liver can't perform lipolysis responsible for breaking down fat into glycerol and fatty acids, the body can't use fat stores for energy, which results in extreme weakness. And we couldn't have made this video without mentioning jaundice. As red blood cells finish their life cycle, they die and secrete a waste product known as bilirubin. A healthy functioning liver processes bilirubin, removing it from the bloodstream. With that said, jaundice is a condition where the liver is unable to process bilirubin, which results in a yellowish discoloration of your skin and the whites of your eyes. That is why jaundice is often recognized as a very clear indication that something is wrong with the liver or pancreas. In the case of fatty liver disease, jaundice is also an indication that the condition has progressed to an advanced stage. Therefore, please seek immediate consultation with a doctor who can diagnose the problem. The next symptom on our list is dark-colored urine. That's right, unfortunately, orange or dark urine is common in people suffering from fatty liver disease, especially if they already have jaundice. The reason why urine is unusually dark is that the kidneys take on the responsibility of the liver and excrete bilirubin in the urine. Dark-colored urine often indicates that bile flow has slowed down significantly or stopped, which is a condition known as cholestasis. That explains why cholestasis is commonly associated with liver disease. Swollen legs is another symptom that we need to mention. When the liver isn't functioning properly, fluid can build up within the lower extremities, causing the legs to swell. This type of edema is a common symptom of a wide range of diseases, mainly relating to problems with the circulatory system. However, when combined with other symptoms on this list, it can definitely be an indication that fatty liver disease is present. To help, wearing compression stockings can be a temporary solution for swollen legs. However, whatever is causing the edema must be corrected for this symptom to go away. Moving right along, another symptom to look for is breast enlargement in men. As you can imagine, this often comes as a surprise to most people. Breast enlargement in men is a condition known as gynecomastia. It's an indication of hormonal changes within the body. If the liver is unable to function properly, these hormonal changes can occur, resulting in high estrogen production. And unfortunately, high estrogen levels in the bloodstream naturally results in breast enlargement. Additionally, some drugs that are used to treat liver condition can also result in this condition as well. So just to give a quick recap, the top 10 signs and symptoms of fatty liver to be aware of include abdominal pain, fatigue, loss of appetite, unexplained weight loss, nausea, weakness, jaundice, dark-colored urine, swollen legs, and breast enlargement in men. Real quick guys, do me a huge favor and hit the like button. It really helps support the channel and I greatly appreciate it. And while you're down there, go ahead and click the subscribe button as well, because we have a ton of other videos on our channel that I think you will enjoy. Millions of people around the world are looking to avoid fatty liver disease and improve their overall health by taking good care of their liver over time. Hopefully the information that you learned in this video can help you do just that. With that said, keep in mind that we are not doctors and this video should not be taken as medical advice. Again, this video is for informational purposes only. But hopefully you learned a thing or two, and hopefully you're now one step closer to improving your overall health and thus improving the overall quality of your life. If so, be sure to let us know down in the comment section below. And if you want to learn even more about this topic, we do have a full guide on our website. I'll drop a link to it right below this video down in the description. Thank you so much for watching all the way to the end. Have a blessed day, and as always, breathe easy, my friend.